Ted and Dave are playing squash. Ted is losing. Then the unimaginable happens. Don't panic. Hands-only CPR is a valuable skill that can save lives. Thankfully, Dave knows it. Watch him carefully. The first steps are known as DRS. It means to check for danger, check for response, shout for help.
Help!
Call ambulance 995 and follow the dispatcher's instructions. Next, follow the ABC method. A is for AED, which stands for Automated External Defibrillator. Get an AED if it is visible and nearby. If there are other people, get them to do it for you. B is for normal breathing. Look at the chest for the rise and fall of normal breathing. Agonal breathing or gasping is not normal breathing. CPR is required if there is no normal breathing detected. Remove casualty's t-shirt and compress at correct location, lower half of sternum. C is for continuous chest compressions. Expose the chest adequately, removal of t-shirt, and provide continuous chest compressions at a rate of 100 to 120 compressions per minute at a depth of 4 to 6 centimeters. Make sure to completely relax pressure in between compressions. If rest is needed, do not exceed 10 seconds. Only stop when AED arrives and starts to analyze heart rhythm. The casualty is breathing normally and/or wakes up. Paramedics take over. Arrival of the AED means Ted's heart can be analyzed and shocked if needed. It's really simple. First, ensure that the area is free of wet surfaces, metallic surfaces, flammable gases. Continue chest compressions. Turn on the AED. Ensure that the chest is bare, dry, and clean. Apply pads as shown. Place the defibrillator pads as instructed. When the AED starts analyzing,
do not touch the patient. Shock advised.
Do not touch the casualty when AED is analyzing or delivering a shock until prompted safe to do so. After shock is applied, resume chest compressions and follow the AED prompts. There may be situations when the AED does not advise a shock.
No shock advised.
Resume chest compressions and follow the AED prompts. Stop CPR when the casualty is breathing normally and/or wakes up. The paramedics take over. Do not move the casualty or disconnect the AED until the paramedics are ready. The paramedics may ask for time of collapse, how long chest compressions were performed, how many AED shocks were delivered. Ted was lucky to have Dave there. Be CPR and AED trained today. You have the power to save lives.
Okay, I've seen the video.